Hi, I'm Dr. Kevin Haney.
And I'm Alex Beaumont, Clinic Coordinator of the Edge at Pinnacle Point. At the Edge, we cater individualized care plans to suit our patients' needs and help them feel better.
We believe that our approach to hormone replacement therapy is innovative, efficient, and effective. Here is some more information about men's health issues.
Hi, my name is Alex Beaumont. I'm the Clinic Coordinator of the Edge at Pinnacle Point, and today we're going to talk about health management, energy, and weight loss. Regarding energy, wellness, and weight loss, yes, TRT is the thing that is going to help you get you over that hurdle, or that plateau where you're stuck. Maybe you're not losing the type of weight that you'd like. Maybe you're not putting on the type of muscle that you'd like. As a disclaimer about the muscle, yes, you will see some lean muscle improvement in definition while being on TRT, but it's never our goal to get you to look like Arnold or to get you freakishly big. Again, we are approaching this thing from a wellness standpoint and getting your testosterone into a therapeutic range. While what we do is helpful in regard to your energy management, your weight loss goals or needs, there is still some personal accountability that is needed throughout the process. All right, and what I mean by that, namely, is lifestyle changes. If you are coming into us and maybe you are a little more out of weight or a little more sedentary, yes, the expectation is that this isn't a magic bullet or a magic shot, I should say. You will have to make some changes in your life in regard to eating cleaner, intermittent fasting. I'll preach it to the cows come home, and of course, introducing a little bit of exercise into your life. And I'm not saying jumping out of the gate and trying to move mountains, just baby steps and get yourself there, but just some sort of activity, focus, change in your lifestyle. So some of the treatment options that the Edge offers aside from TRT is lipolytic, lipo-B shots, in that it's a compounded intramuscular injection, one part B12, which helps raise your body's energy metabolism, and that you're going to burn more calories. But a combination of lipolytic agents. It's more commonly known as MIC, and what it does is it works in concert with the B12 to just put you into the state of lipolysis, in that you're going to start burning more fat, but also lowers your body's predisposition to actually making and storing fat. We also offer our InBody, which is right behind me here. Fantastic machine. It's a full body metrics analyzer, breaking down not only your weight, but your water weight, your dry lean mass, your percent body fat, your skeletal muscle mass in pounds. And so it's just a really good tool that we use, and I call it all the time, it's kind of cheesy, but it's our proof is in the pudding. It's, here is where you've started, and now here are the changes as your body undergoes this transformative process as it starts to adapt to testosterone. If you have any other questions about energy or weight loss or testosterone, feel free to give us a call at the Edge.